Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Thanks to modern medicine and advancements in healthcare, we are living longer than we ever have before in human history. But longer lives and medical breakthroughs do have their downfalls, including a new public health issue. Older Americans are contracting and spreading sexually transmitted diseases at record numbers. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. Today we focus on sex education and health. Stay tuned. Welcome back. Sexually transmitted diseases and HIV cases have increased at record numbers among older adults, according to the Centers for Disease Control and Prevention. Sexually transmitted diseases, or STDs, and HIV have serious health risks. I would like to welcome Dr. Saul Rivard from Pureview Health to the show this morning. Thanks for joining us.
Thanks so much for having me.
So we've talked a lot on our show about how important it is to be open and honest when talking about your health with your doctor. Do you think it helps to have just one primary care physician to kind of help open up that relationship, or what's your thoughts there?
I think that it's really important to have one primary care physician, and that's for a number of reasons. I think number one, it gives us a really clear insight into a person's overall health and well-being, and that longitudinal relationship is really important to be able to kind of guide you through certain conditions or management of diseases and see you through the different seasons of life. I think it's really important and neat that us as primary care physicians get to be with people throughout all stages of life. But really, whether you're seeing one doctor or many doctors, it's super important to be honest and open with your doctor. And that honesty really helps us to get a really intimate understanding of your health. And doctors like information, and the more information we have, the better we are to give you guidance and help treat some of your conditions or diseases. Of
course, perfect. So we're talking about sexually transmitted diseases today, which might be a little bit of a tricky topic. Somebody might feel embarrassed to bring up something like that. Any tips or advice on how to approach that conversation from the patient's perspective?
Yeah, people might feel embarrassed or hesitant to discuss their sexual health with their healthcare provider, but they really shouldn't feel ashamed at all. I think that one important and key points to make today, and especially for some of our rural viewers, is that anything that you say to your healthcare provider is strictly confidential, meaning it shouldn't leave that exam room when your visit is over. And you really shouldn't feel embarrassed at all talking to your healthcare provider about sex. One way to bring it up is to just say, hey, I'd like to talk about my sexual health today. So that's what I would recommend.
Okay. Is it helpful to prepare for that conversation ahead of time? How would you go about doing that?
I think being prepared to discuss the subject with your doctor is a really good idea. And my recommendation would be to bring it up right at the start of your visit. Not wait until the very last minute. And really the earlier you bring it up in the visit allows you more time to discuss that issue and ask any questions that may come up. And I would also urge people to make a list of questions that you might want to ask, because so often, anybody who goes to the doctor as they're walking back to their car after the exam, like, oh, I should have asked this one question. Bringing a list will help kind of make sure that you hit all the key points that you want to address.
That's great advice. Thank you for that. So what if someone just flat out does not feel comfortable talking to their provider, either about their sexual health or if they're concerned about an STD? What do they do?
Well, if a person doesn't want to be honest or open with their PCPs, they feel embarrassed or ashamed, they can always go to another doctor or another clinic. For whatever reason they feel more comfortable seeing somebody that they don't know, then that's a good option. But an important thing is if you do have an STD, or a condition, make sure that you tell your PCP. Like I said before, the more information we have, the better able we are to provide good health care.
Okay. So if an older patient, or any patient actually for that matter, is sexually active, what sort of information should they be sharing with their provider?
Well, if they suspect that they may have some sort of condition, telling your provider what sort of symptoms you're experiencing is always a good idea, and ask to be tested for STDs. Your provider will tell you which ones are appropriate to be tested for. Another key piece of information that's helpful for us is letting us know how many sexual partners you've had in the past 6 months, and what sort of protection measures you've used, if any, and how consistent you were with those protective measures is always helpful to help guide us again into providing good health care and checking STDs as necessary.
Okay, and so you mentioned the multiple partners. If someone is sexually active with more than one person, how often would you recommend they get screened?
Typically, I would recommend getting screened annually. However, I do say that with a little bit of caution, as some folks may feel a little bit more comfortable getting checked for STDs as they enter new relationships, in which case I think that's absolutely appropriate.
Okay. Is an early diagnosis of an STD, can that save somebody from having long-term problems?
Absolutely. Many STDs, as we know, have long-term health care or health consequences. And it's so much easier to test and treat a condition earlier on. And this is certainly the same case with HIV. And it's also important to note that if somebody has multiple sexual partners, getting tested and treated for sexually transmitted diseases or infections can help to keep those from spreading to your partners.
Okay, so just one final question. We're about out of time here, but we mentioned at the start of the show that the rate of STDs among older adults, we're talking 45 and older, is on the rise. A thought or two on why you think that might be happening?
I think it's probably for a number of reasons. Number one, Americans are living longer now. And there are new medications out there like Viagra and hormone replacement therapy that are making sex possible. Another thought is, perhaps the older generations hadn't gotten quite the same safe sex messages that the younger generations had. Sure. So they might not be taking the necessary precautions to encourage safe sex and prevent infection.
Okay. All right, great. Thank you so much, Dr. Rivard.
Thank you.
We need to pause here for a break, but we'll be right back after these messages. Stay with us.